We've been doing this about 2 years now. And what we did was the whole concept is that based on the CDC guidelines for normal vital signs, we incorporated that. And if any of the patients were outside that category, and obviously if they're over 18, because if you're pediatrics, your vitals are different. So if you're outside the normal parameters of CDC guidelines for vital signs, that's a checkbox yes. The second checkbox is basically SIRS criteria, which is pre-sepsis. It's not really sepsis. It's the body's systemic inflammatory response. And part of the sepsis bundle is lab work, which we can't do.
Right.
But we realized a lot of high-risk patients are nursing home patients. They have immune-compromised systems. They have HIV, cancer. So if they have those are high-risk patients for sepsis. So as their immune system can't function as well. So we included that and replaced the lab value, because again, we have no lab testing. And if any 2 out of the 4 were positive for SIRS, the last part was, how do we find a lactate equivalent? And the lactate equivalent was done by using the modified shock index, which is mean arterial pressure over heart rate, or the shock index, which is heart rate over systolic blood pressure. So if either one of those were positive, your shock index less than 0.7 or greater than 1.3, or your shock index is just greater than 1.0, then you'd call it yes as a modified shock index is positive, or shock index is positive. Then the patient's lactate equivalent would call a septic alert. The medics would start hanging fluids, 30 cc per kilogram, based on ideal body weight, so up to 2 liters prior to getting to the hospital.
Great. And what has the response been with the hospitals in your area that you're delivering these patients to?
Actually, surprisingly, really good. And I think at first people get suspicious of something new. My boss said there's 2 things that people don't like: change and the way it is. So we figured we'll try the change part. And so with the change part, we're saying, well, did you recognize them early? Well, once they started doing data collection, which we do monthly with our hospitals, we found that it was like a 95% admission rate. About 70% of these people were actually purely septic. We caught a lot of people before they became septic.
Great.
So the fact is, people were being admitted at about 95% accuracy with this protocol. So as the hospitals got the data and said, this really works, they became more agreeable to being more aggressive, more early data collection, more aggressive initiation of therapy. And my next thing is to see the mortality drop, hopefully, by the fact we've recognized it early for the last 2 years, and compare it to their mortality stats before we did this protocol to see how much of a difference we're making.
Great. Well, it sounds like a truly excellent program, and I'm so happy that you're making this difference. We look forward to learning a lot more about it in your future work.
Thank you so much for your time.
Thank you.